What is pelvic organ prolapse? I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. And in this video, I'm here to tell you about the three kinds of pelvic organ prolapse. So what is prolapse? The word prolapse in any part of the body essentially means that something has shifted out of its proper position, that it's not where it belongs anymore. And in the pelvis, pelvic organs are down in here. So this is your pelvis, these bones. This bowl of muscle here is the pelvic floor. And inside this bowl are your pelvic organs. So we have the bladder in the front, uterus in the middle, and your rectum in the back. And they're all nestled in here, very cozy, like pieces of a jigsaw puzzle together. So if you have a prolapsed bladder, it's called a cystocele. A prolapsed rectum is called a rectocele. And if you have a prolapsed uterus, it's just called a prolapsed uterus or uterine prolapse. What happens when the organs are prolapsed, and you can have one or any two, or you could have all three. And what happens is that the organs literally fall through a gap in the muscle called the urogenital hiatus. So I'm going to take off this outer layer of muscle and show you. So here's the urogenital hiatus. That's a gap where the vagina and the urethra pass through this muscle to the outside. And literally the prolapsed organs will bulge through this gap in the muscle. And sometimes women are concerned, particularly if you have a cystocele, the bladder, or a rectocele with the rectum. Yes, that is the bladder or the rectum itself taking up space in your vagina, but it is covered by the vaginal wall. Sometimes women are thinking like, I'm open to the outside, my organ is right there. Yes, it's right there, but it is covered by the vaginal wall. Now, if you have a prolapsed uterus and you reach in and feel, which is still totally safe to do, by the way, if you have prolapse, it's perfectly safe to put your fingers in there. It's safe to have sex. If you are feeling around and you can feel your cervix, yes, that is your cervix, the neck of the uterus itself that you feel, because that's how the uterus is. The cervix is something you can feel. Even when it's perfectly positioned, you can feel your cervix itself at the end of your vagina. So prolapse can be mild, so mild you don't even know you have it, or it can be severe, so severe that it really limits your ability to live a normal life day to day. So that's the basics of what pelvic organ prolapse is. And to find out more about prolapse and how Kegel exercises, as long as they're done correctly, how those exercises can help you, please visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.